Well, chronic, non-communicable diseases have already plagued the nation, through in COVID-19, and that seems to have made the situation a whole lot worse. 47% of the population already suffers from high blood pressure, 26% has diabetes, and of course, the Bahamas is among the most obese nation in the Americas. Well, Dr. Carneal Parkinson, a family medical consultant at the Princess Margaret Hospital, shared some tips on what people should keep in mind.
Three main things that we try to emphasize. One, improve diet. Two, exercise. And three, managing stress. So in terms of exercise, most people are confined to home. They can't go out, whether it's because they're not allowed out on the road, or because they want to stay self-isolated because they don't want to expose themselves to other people. Some of the things that we can try to do is hopefully with the access to the internet, we can try online resources. There are a lot of different exercise people who have online videos that you can do simple exercises within your home. When the curfew is lifted and you actually have the opportunity to get outside, walking through your neighborhood is another really good thing.
Well, with case numbers continuing to increase, Dr. Parkinson says for persons to remain calm, but to reach out to relevant authorities if they have concerns.
We're seeing a little bit more spiking in people having symptoms, and it's hard not to be very concerned, panic, become anxious, and unfortunately that's the time when we start to make mistakes in our behavior and things that we do. Try to keep focused. Again, try to remember that it's not just us individually, but as a community. Continue with your social distancing, continue with the hand hygiene. If you're concerned about anything in terms of symptoms, call the COVID hotline, 511. There's also the 411 and the 311, contacting NEMA and the police for other reasons. Minimize any travel.